Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist with the NASHUA Division of Public Health and Community Services. And I'm joined today by Dr. Pamela Beahm, who's a pediatrician with St. Joseph's Hospital. And welcome, Dr. Beahm.
Thank you for having me.
So we're really glad to have you here. We always start our shows with a little bit of a COVID update. So I'm going to go through that, and then we're going to turn to what you do and your recommendations for kids during these trying times, so to speak. So on a national level, we just want to report that we still have high transmission across the United States. If you're reading the news, you probably know that. 99% of the cases are from the Delta variant. The majority of hospitalizations due to COVID-19 are in those that are not vaccinated. There are breakthrough cases that are being reported, but generally most of those ending up in the hospital are unvaccinated. We've heard a lot about variants of concern, and this is something that we were sharing before the show, that we now have this Omicron variant. And so this next graph shows us that the Omicron variant is growing, and it's very subtle, but if you look at the bottom of that orange graph, you'll see a purple chunk, a little purple rectangle. And the purple rectangle is what is Omicron right now. And while that looks very small, if you just look at the bar above it, you see that it was barely there even a week ago. So the transmission rates of Omicron are very concerning. And so all the more reason to take precautions as we go through the holiday season. Looking on a national level, we do have this map of the United States. Our 7-day transmission case positivity per 100,000 is 252.1, and the overall positivity rate in the United States is 7.25%. You'll see, though, this differs very much from NASHUA. NASHUA is in quite a different situation, as is the whole state of New Hampshire. And you can look on this map and you can see how dark all of those New England states are, and that our transmission, our case per 100,000 is very high. So in New Hampshire, we have 181,660 COVID cases reported to date. We have 9,607 active cases. Our test positivity rate is 11.8%. That again is for the whole state. On December 16th alone, we had 1,126 new cases reported, which is really high. That's a lot. This is a small state. So when you have over 1,000, that is just a huge number for us. What's mostly concerning too is these hospitalizations. We have 463 hospitalizations right now. And we've had 1,828 deaths in our state. And our sympathies go out to family and friends of those affected by this pandemic. Coming back to NASHUA, which is where this show is based, we have 619 active cases currently in our city. New infections per 100,000, 1,252.7, quite a bit higher than even the state rate and vastly higher than the national rate. Our 7-day total test positivity rate is 15.8%. If you look at Greater Nashua, 1,331 active cases. And in the city of Nashua for vaccination, we have 53.1% vaccinated fully. We have work to do, folks. And in Greater Nashua, 52.9%. So in New Hampshire, the total is 55.6%. On a positive note, we have seen those rates go up over the last week or 2 weeks. We do this, we film the show every 2 weeks. So when I look at checking these numbers, we have gone up about a percentage point for vaccination, but we need that to accelerate even more if we're going to get through this winter. So I think I'm going to turn now to you, Dr. Beahm, because we're really here to talk about pediatrics and to, without too much delay, to talk about the vaccine that's now available for kids that are 5+. But before we get to that, tell us a little bit about yourself.
So thank you for having me on to talk about this really important subject. My name is Dr. Pamela Beahm. I am a pediatrician in Nashua. I work at St. Joseph Hospital Pediatrics, and I have been practicing in this community for 22 years.
Oh, wow.
So Yes.
So you know the area very well.
I
and
know the
people.
area very well, and in my 22 years of practice, I've never experienced anything like this. So this is really important that we talk about the vaccinations to try and get us past this pandemic.
Absolutely. So tell me, as most of your patients, you see up to what age? And
so we will see patients from birth through college. So I call the 18 to 22-year-olds, we call them the gray zone. That's kind of when they start to transition to the adult practices.
So I have a question, though. So have you, I guess first and foremost, have you seen COVID-19 in your practice?
Yes, we have seen a lot of COVID-19 in the practice, and certainly over the past several weeks, we have seen an incredible increase in the number of cases.
So are kids coming into the office with COVID-19? What kind of symptoms are they presenting with? Are they handling it pretty well? I mean, how is that going?
So there's a lot of variability as far as where kids are getting diagnosed. They're coming into our office for testing. Some of them are doing testing at home. Some of the schools are doing testing, or they're going to emergency rooms or urgent care centers. So this really is a community-wide effort to diagnose children and adults. The symptoms that we will typically see, a lot of them are consistent with upper respiratory infections. So kids are having runny nose, coughs, fevers, headaches, body aches. Sometimes it can be just gastrointestinal symptoms like diarrhea and vomiting in children as well.
So you're definitely seeing a whole range of symptoms.
Very much a range of symptoms, from mild symptoms to more severe symptoms, kids with breathing difficulties.
So beyond, obviously if they have a breathing difficulty, you're very concerned, but, you hear a lot of people say, this isn't really a disease for kids. They all recover. So how do we counter that? Because I don't believe that's true, and to me, even one child passing away from a preventable illness is too many.
I agree.
And, we know, like, nationwide, it's close to 200 children. And I don't know if you have that number exactly, but.
Yeah, so thankfully, most children do have milder disease than the adult population. And so we're seeing kids that have the cold symptoms, the fevers, but they can be sick for quite some time. Unfortunately, there are still children that do get severe disease and can require hospitalizations, and we even have children that die from COVID or COVID-related conditions. There actually have been about 1,000 deaths of children nationwide from COVID.
Okay.
And that can be from COVID itself or from like the multi-system inflammatory syndrome that we can see several weeks after COVID.
And is that something you're seeing mostly in infants, or?
So actually the age range that has the highest incidence of the multi-system inflammatory syndrome is the 5 to 11-year-olds. The median age is 9 years old for that.
Oh, okay.
So that is the highest risk group for that particular condition.
So just to show our audience a little bit of data, we were looking at a graph beforehand that will pop up on the screen that shows in New Hampshire, we actually have close to 20, this graph goes up to 19 years old, but we'll include that in the 18 for purposes of illustration. But 28% of the cases in New Hampshire has been in this combined age group from 0 to 19. So this is no longer an illness for the old people, the people in the nursing homes. It's here, it's in the schools. We have a lot of clusters in our schools and breakouts really in the schools, different classrooms, different schools. I mean, it's on the news all the time. So we just want to emphasize that, this is not just an old person's disease. And and when I think about kids, I mean, there are other risk factors too, because kids go home to their families and they can transmit it.
Yeah. So in addition to the disease that kids get themselves, they also can transmit it to other family members who either may be more vulnerable to severe effects from COVID or who aren't eligible to get the vaccine at this time. So.
Right, because a lot of kids have younger siblings. And, right, so it's really a family affair. And if you live in a multi-generational household, And as we've seen, even if you have the primary series of vaccination, there are breakthrough cases.
Absolutely.
So if you're living with grandma and you come home with COVID, unknowing, usually at first, you really are exposing your family to that as well. So, first and foremost, when we talk about mitigation right now and how to lessen the transmission of COVID, we talk a lot about masking. So before we get to the vaccine, which is really key, I want to talk a little bit about masking and why it's so important. And if you could help us with some of the science behind it, that would be great.
Yeah. So, there's just multi-levels of what we can do to try and mitigate COVID-19. And certainly one of the biggest ones is masking. Masking helps to prevent transmission of COVID. And so, the studies have shown that masking significantly decreases the risk of spreading COVID from one person to another, particularly if you're indoors or if you're in closer contact. So that is something we recommend to everyone, to be part of the solution and to please keep wearing that mask. And you may be around people that are immunocompromised and, like you had said before, someone that can't get the vaccine. Yeah.
And so we really want to be respectful of the other members of our community. And kids are still wearing them in schools, at least in NASHUA. I know that they are wearing them.
Yeah.
And that, it's not a perfect solution, but it definitely gets us a little bit closer to where we do to reduce that transmission.
Sure. And the American Academy of Pediatrics strongly encourages kids to be wearing masks in school.
Yeah. And even when they're out and about, like in the grocery store and especially different places where you really don't know the people that are around you and what their habits are. So now the big reveal is we have this vaccine for those that are 5 years of age and older.
Yes.
And it's definitely, we've had a lot of parents, at least from a public health perspective, we've had a lot of parents inquire about the vaccine. We've been able at Public Health to deliver about 700 full series of shots, so that was really exciting for us. We hope to do more. Our clinic's open 4 days a week, so we also encourage people to make an appointment there. So would you recommend getting the COVID shot?
I absolutely recommend getting the COVID shot, and we're so excited that we now have this vaccine available for children 5 years and older. So I do think that vaccination is going to be one of the best ways that we're going to be able to mitigate COVID and get past this pandemic. The more people that we can get vaccinated, the less this virus is going to spread, and the sooner we can get back to living our lives normally again.
Wouldn't that be nice?
And that would be very nice. We're not there yet, and we need to keep up vigilance, but...
So the science behind the vaccine, just to repeat, it's the same for the adults, but is it safe? Why is it effective? What are we trying to prevent with it?
So the vaccine is definitely very safe and it's very effective. The vaccines, what we're doing is we're giving them the instructions on how to make the protein that is called the spike protein, that is what identifies the COVID virus. And when we give them this messenger RNA vaccine or the viral vector vaccine, which is not approved in children, so it's just the messenger RNA vaccines at this point in time, the Pfizer vaccine. That messenger RNA gets into our cells, our immune cells, and it teaches the body how to make the protein, and then that causes an immune reaction, so our body builds up antibodies against that spike protein. The messenger RNA is then broken down and the body gets rid of that, but then the body is left with antibodies to help fight off the COVID virus if a person is exposed to that virus.
So it's an interesting technology because it's actually been around for quite a while, and now we have a very important use for it. And the big thing about we like to have, no vaccine is perfect.
Correct.
But we really want that protection against a serious illness and the death, and also that transmissibility, especially among this age group.
Right.
They're in close quarters, they're in schools, they're in the gymnasium, in music class, wherever they are. We want them to transmit less as well.
And the studies on this vaccine, when they did the clinical trials, they showed that the vaccine is 91%, has a 91% efficacy in preventing transmission and preventing infection from COVID-19.
Which is huge.
Which is huge.
For any vaccine.
For any vaccine. I think that it has to be at least 50%, and this one is 91%.
And I think we see that with flu. Flu is never 100%. It gives us a layer of protection. It's not perfect, but it does give us a layer of protection. And this one, the COVID vaccine tends to be much higher than even a flu vaccine.
Than the flu vaccine. And it also, for people that do get the breakthrough cases, the disease is milder than we think it's milder than it would have been if they had not been vaccinated.
And that's what I say to people when they tell me that. I said, but you didn't get very sick, right? And they're like, no. I said, but it's because you were vaccinated.
Yeah.
Now wait your 10 days and go get your booster. You know, wait through your isolation and get your booster shot.
Yep.
So what are there side effects from the COVID-19 vaccine that people should be aware of?
So every vaccine that we give can have the potential for side effects, and the COVID-19 vaccine also has potential for side effects, but generally the side effects are mild to moderate, self-limited, and they're not dangerous. The most common side effects that we see from the vaccination are local side effects, so tenderness, swelling, or redness at the site of the injection. People can also get some flu-like symptoms, some fever, headache, body aches, chills, fatigue. Generally that will last just a couple of days and go away. In the adult population, there have been some reports of allergic reactions, anaphylaxis, and there's been some rare cases of myocarditis. Again, these more serious side effects are extremely rare. In the clinical trials, they did not see any allergic reactions or any cases of myocarditis in the younger children, but we will be continuing to watch for any of those more severe side effects.
Yeah, and anecdotally, when I checked kids in with their parents for their second vaccine, we would always ask, did you have any side effects or reactions? And everyone was like, no, no, no. And the most common thing is a sore arm.
The sore arm is the most common by far, yes.
Yeah. So, so we're talking about the vaccine, and now we have boosters available for 16 and 17-year-olds, which is also in your ballpark. So what do you think about that?
Absolutely. So over time, even though we get great immunity from the 2-dose series of the Pfizer vaccine, over time that immunity, so those antibody levels do decrease. And so the booster dose, that just helps to build up our immunity. And every time we get a booster of a vaccine, it kind of supercharges the body and really bumps up those antibody levels so that we can fight off the infection if we do come in contact with it.
Yeah. And I think of like my own 16, not to bring in my whole family into this discussion, but I think of my own 16-year-old. I mean, he's way bigger than I am, and he, had his booster just very recently. But I think that it's to me, it's like he is an adult body right now. And so if it's approved, and he seems to be doing fine with it. So I think it's a great thing. So I'm just going to review while we're here. It's like vaccine boosters are available for 16 plus. If you are 16 or 17, you're only eligible to get the Pfizer vaccine as a booster. So that's just something to keep in mind. Anyone who's had any kind of COVID vaccine, whatever the series was, you are eligible for a booster. If you've had the Johnson & Johnson, you can have your booster after 2 months.
Correct.
And for Moderna and Pfizer, wait those 6 months from your primary vaccine series. And you can mix and match, which is really pretty cool that you can do that. So it is important for people to understand the slight differences. I feel like every few weeks it gets a little bit more complicated. When we did our pediatric clinic, we also offered boosters. And so we just have to be very careful because it is a different dose.
Correct.
It's a much smaller dose for the pediatric clinic. They're getting about a third of what an adult dose is. So we just try to keep those very separate and very safe.
Yes.
So let me see. I know I have a million questions. Is there anyone you would recommend not to get the COVID vaccine? That is, in that age group from 5 to 11?
So the only Contraindication to getting the COVID vaccine is if somebody has had an allergic reaction to a previous dose of the vaccination, or if somebody is allergic to one of the components of the vaccine. The most common component that people have an allergy to is something called polyethylene glycol, or PEG. It's a very rare thing for people to be allergic to, but if you do have a known allergy to polyethylene glycol, you should talk to your allergist about that. But generally that's considered to be a contraindication for the vaccination.
So there are very few reasons not to
Very, very few contraindications, absolutely.
Okay, that's good to know.
You know, people wonder if they have, if they're immune compromised or if they have low immunity, is it dangerous to get the vaccine? And actually in those people, it's even more important to get the vaccination because they are at higher risk for severe disease from COVID.
Right.
So,
Yes, and so we talked about the kids. Let's just remind our parents about what they can be doing as well. And if they haven't gotten their primary series, please.
they should absolutely get their vaccination.
Yeah.
And if they haven't gotten their booster and they're 6 months out from the Pfizer or the Moderna, or 2 months out from the Johnson & Johnson vaccine, then they definitely should get their booster doses as well. And I think continuing to encourage masking, so parents should be masking and setting a good example for their children when they're out in public places.
Yeah, sometimes I see people their kids have the masks on, but they don't. I think, no, we all need to wear them.
All need to wear masks.
So let's just remind people that get vaccinated. Wear a mask indoors, or if you're in an outdoor crowded space, you know, if you're kind of on top of people at a ballpark or whatever, although I'm not really sure who wants to be outside right now, although today's beautiful. Wash your hands. You still want to maintain that space from people that you don't know, because it's just good practice right now. We're in a tremendous surge right now. So these are numbers we have never seen in New Hampshire or in our city. So we have to, as a community, do everything possible to take precautions, to get vaccinated, to help our friends and neighbors, reach out, offer a ride to someone who might need it, to get the vaccine. I mean, there's just a lot of ways that we as a community can help one another. Talk to your friends and neighbors that are hesitant, are a little bit worried, because a lot of us have had it and we're all standing tall and we're doing pretty well. So that's a positive thing.
And yeah, the numbers that you were talking about in New Hampshire are pretty astounding. Even at the peak last year, we have far exceeded the peak last year. And with this new Omicron variant, the concern is that these numbers are going to go even higher, especially because we're getting close to holiday time.
Right.
And that people are going to be getting together. And, you know, I think we just need to remind people to be mindful of these numbers and kind of think very carefully about getting together with family and maybe keeping these gatherings a little bit smaller again this year. Thinking about masking if you know that, particularly if you know that some family members are not vaccinated, and then encouraging everybody who is eligible to get vaccinated.
Right. So as the kids travel with their families, they're going to be coming back. We want them to return to school safely. So again, those are excellent tips, you know, to wear, especially if somebody's unvaccinated at a house that you're visiting. And then when you return from your trip, you know, and you've had a few days at home or whatever, we just want to remind parents, please don't send your kids to school if they have a runny nose or if they have slight symptoms. If any symptoms of being sick, they should go get tested. And make sure that they're taking those precautions, because COVID got ignored a lot. It's just allergies, or I just have a runny nose. I'm like, well, a runny nose is a symptom of COVID. So, you know, they get confused and they overlap. So we just want to make sure that parents are taking those precautions as well.
Right. And we understand that kids don't like to get little swabs put in their nose. We understand that that's uncomfortable. And, you know, we don't have treatments for COVID, but the reason that we need to diagnose it and the reason that we recommend, even with mild cold symptoms, that people get tested for COVID is because we don't want to transmit it to other people.
Right.
So even mild symptoms can be COVID. And so we need to make sure that we're checking and not sending our kids to school if there's a possibility that they have COVID.
Right, absolutely. And then I just have this slide about a ticket to COVID-19 safety. And it just talks about if you are traveling to make sure you wear that mask on the planes, trains, buses, and other forms of public transportation. And if you're going internationally, you do have to have a COVID test no more than 1 day before returning to the U.S. So that is tricky, but necessary. Mm-hmm. And follow the entry rules and requirements of international destinations, which are often even stricter than ours. So again, recommendations: get vaccinated, don't travel if you're feeling sick. Same thing, you're not going back to school, don't travel if you're feeling sick or if you're coughing and sneezing. And if you've been exposed to COVID-19 or tested positive, of course, please do not travel. And track the COVID-19 rates in your region to take extra precautions. And unvaccinated travelers, delay travel unless you're fully vaccinated. That's just the bottom line. You're putting others at risk if you are traveling unvaccinated. And then you would also do those testing requirements. And it is recommended that you do spend some time at home after you return. Again, because you are unvaccinated, you are not as protected. You're more likely to be transmitting COVID. So now that we've gone through all this COVID stuff, it's really exhausting. Any other tips for the kids for winter? I mean, we're going to have other illnesses, any kind of last minute things you'd like to let the kids know? Or the parents?
So I just think trying to keep kids as healthy as possible, making sure that they're getting good sleep, making sure that they maintain a healthy routine, and that they're getting good nutrition. There are no vitamins or supplements that are recommended to prevent illness. The best thing that we could do is just keep them healthy and make sure that they're eating healthy and getting plenty of fluids and getting good sleep.
Great advice.
And then getting your vaccines.
Right. Well, thank you so much, Dr. Beahm,
for
joining us.
It was a pleasure.
And spreading this very important message. I do want to remind some folks that we will have a booster blitz in the Greater Nashua region in Milford on January 8th. That registration is going to open up after the new year, but keep your eyes and ears open because information is constantly changing. There's free COVID testing available at 261 Lake Street. That's St. Joseph's parking lot. It's open 9 to 3, 7 days a week. So if you're looking for a COVID test, it's drive-through. You do not need an appointment. And finally, you can visit our health clinic at Public Health, where immunizations are held Tuesdays, Wednesdays, Thursdays, and Fridays now. Call for an appointment at 589-4500. We want to thank you for tuning in to Public Health Matters, and we hope you have a safe, healthy holiday and a happy New Year.